So what happened to me inadvertently in about 2001 was I picked up this book called Feeling Good by David Burns. And David Burns said basically to write, so I started to write. And he had a 3-column technique where you wrote down the negative thought, then you categorized it, then you wrote down the more rational thought. That 3-column technique, writing, not just reading it, but writing that 3-column technique, pulled me out of the deepest hole you can imagine. So what I have my patients do now to start out the reprogramming process is simply write. Just write down the most negative, bizarre, despicable, unspeakable thoughts you can get on paper. The darker the thoughts you can get on paper, the more effective the process. You have to instantly throw the piece of paper away. And it's not a cathartic effect, it's that you simply want to write with absolute complete freedom. So I have many patients who never get to the 3-column technique. Just with the writing alone, they come out of the hole. I may have one woman who had a 40-year bipolar disorder. She became paraplegic because of really bad spine surgery. About 8 months ago, she broke her bipolar with just writing. She's happier now, paraplegic, than she was bipolar and walking. I'm blown away. And truly, this is one person I never remotely expected to do well. And not only is she paraplegic, she's having every complication in the world you can imagine with the paraplegia, and she's actually dealing with it. So writing is the first step. Just get used to the writing process. I think the second step is the 3-column technique with Dr. Burns. At least it's my sequence that worked for me, and it seems to be working for a lot of my patients, is that what the 3-column technique does, it does the awareness. In other words, you become aware of the negative thought. Then as you categorize it, you're detaching or de-energizing it. And then the third step, when you write down the more appropriate thought, you're reprogramming. So again, there's a lot of other tools. Other things are awareness, mindfulness. You can do it through art, music, sound. So again, any technique that associates thoughts with physical sensations creates a different neurologic pathway.